Hello, you're watching Wellness Watch on DD India, your weekly dose of wellness and good health. We all want a long life, but more importantly, a healthy one. Welcome to the show that cares for you. Did you know that you could lose your vision slowly without even feeling pain? Imagine your world slowly dimming, not because of light, but because your vision is gradually being taken away silently and painlessly. This is what happens in glaucoma, often called the silent thief of sight. Glaucoma is one of the leading causes of irreversible blindness worldwide, yet early detection and timely treatment can save vision and preserve quality of life. Today, in Wellness Watch, we explore what glaucoma is, how it affects the eyes, and most importantly, what can we do to protect our sight before it is too late. I'm Preeti Kaur. January is observed as Glaucoma Awareness Month, focusing attention on a disease often described as the silent thief of sight. Glaucoma is among the leading causes of permanent blindness worldwide. What makes it particularly dangerous is that it usually develops without pain or early warning signs. By the time vision problems are noticed, the damage is often irreversible. The reassuring fact is that regular eye examinations and timely treatment can help protect eyesight. Here's a report by DD India's Harshita Oberoi on why glaucoma develops, who is most at risk, and how timely care can prevent and, in fact, protect vision.
Glaucoma is a group of eye conditions that damage the optic nerve, the vital connection that carries visual information from the eye to the brain. This damage is permanent and cannot be repaired. As a result, any vision lost due to glaucoma cannot be regained. In most cases, glaucoma is linked to increased pressure inside the eye. The eye contains a fluid that helps maintain its shape and nourishes important structures. When this fluid does not drain properly, pressure builds up within the eye. Over time, this rising pressure compresses blood vessels and nerve fibers, gradually damaging the optic nerve and leading to progressive vision loss. What makes glaucoma particularly dangerous is that it is usually painless and symptom free in its early stages. There is often no redness, irritation, or noticeable discomfort. Vision loss begins quietly, affecting peripheral or side vision first. Central vision remains normal for a long time, allowing the disease to progress unnoticed. By the time vision problems become obvious, significant or irreversible damage has already occurred. Glaucoma is more common in older adults, especially after the age of 45 or 50. People with a family history of glaucoma face a higher risk. Conditions such as diabetes, high levels of myopia, and long term use of certain medications, particularly steroids, can also increase susceptibility. Because glaucoma often goes undetected, routine eye examinations are the most effective way to diagnose it early. Eye specialists check eye pressure, evaluate side vision, and examine the optic nerve for early signs of damage. Because glaucoma progresses silently, routine eye checkups are the only reliable way to detect it early. There are different forms of glaucoma. Open angle glaucoma is the most common type and develops slowly without symptoms. Angle closure glaucoma appears suddenly, causing severe eye pain and headache and requires immediate medical attention. Congenital glaucoma affects infants, while normal tension glaucoma can damage the optic nerve even when eye pressure remains normal. Glaucoma has no cure, but it can be managed throughout life. Treatment aims to lower eye pressure and slow further damage. This may include daily eye drops, laser treatment, or surgery to improve fluid drainage from the eye. Consistency is crucial. Skipping medication, even after surgery, can lead to further vision loss. Glaucoma does not steal vision overnight, it works quietly over years. But early diagnosis and timely treatment can slow its progress. Since lost vision cannot be restored, awareness and regular eye checkups remain the strongest defense against this silent thief of sight. Harshada Oberoi's report for Wellness Watch, DD India.
So glaucoma damages the eye's optic nerve and can result in vision loss or blindness. According to WHO, it is the second leading cause of blindness globally, and it is a major cause of irreversible blindness in India, affecting more than 12 million people. But critically, up to 90% of cases remain undiagnosed, often identified only in the advanced stages. Today in the show, we look for these answers. What is glaucoma? What are the types and stages of glaucoma? Is glaucoma permanently curable? What is the preventive care to be taken? And what are the medical advancements in India? Glaucoma treatment in India focuses on lowering intraocular pressure, that is IOP, through eye drops, laser therapy and surgery to prevent optic nerve damage, which with costs varying by procedures. Advanced centers offer comprehensive diagnostics and also specialized care. Up on your screens, we have some hospitals and institutes that specially cater to this. Dr. Rajendra Prasad Centre for Ophthalmic Sciences, AIIMS, Delhi. Safdarjung Hospital, Delhi. Visual Institute of Ophthalmology and Government Ophthalmic Hospital, Chennai. And Guru Nanak Eye Centre, New Delhi. National Institute of Ophthalmology, Pune. All right, to help us understand glaucoma better, we're joined in by guests in the studio. We're joined in by Dr. J.S. Titiyal, former Chief and HOD, Dr. R.P. Centre for Ophthalmic Sciences, AIIMS, Delhi. Thank you so much, sir, for joining us this afternoon. To begin with, you've shown a great detailed report talking of glaucoma, but in very simple layman terms, I would want you to explain to our viewers what is glaucoma, how is the optic nerve of a person blocked?
I think it was very nicely explained in a promo. Glaucoma is a disease which we know that once it is in the later stages of its activity, you lose the activity of your optic nerve. The basic concept in glaucoma is to protect the optic nerve function, which is going to take your vision to the brain, and that's the main tissue which has to be preserved, because we know that nerve tissue, once it is damaged, it cannot recover. Therefore, the idea is to know what is glaucoma, who are those people who can have the glaucoma in their life, and how do we prevent the damage happening to optic nerve. As we briefly saw the reports, glaucoma can be divided into two categories. One is primary glaucoma, one is secondary glaucoma. Both are important. Primary glaucoma is of two major types. One is the open angle glaucoma, second is the closed angle glaucoma. What is this angle? Angle is a space in the eye from which the fluid which is generated inside the eye to maintain the shape of the eye, the fluid is seeped into the other parts of the eye through this angle. Once the angle is damaged, blocked, or the fluid pressure is such that it doesn't go out of the eye, then your pressure of the eye increases, which is called intraocular pressure. This pressure rises, therefore, there is a direct impact on the optic nerve, which is behind the posterior part of the eye, and once it is damaged, basically damage is sort of a ischemic damage, because with the pressure, the supply to the optic nerve fibers will decrease, and ultimately it will get damaged. Therefore, it is important to decrease the intraocular pressure, because that is the most important parameter in glaucoma which can be controlled. There can be various other ways by which glaucoma can occur, like we talked about normotensive glaucoma. Some people may have a normal pressure, still they can have a glaucomatous damage to the optic nerve. Second important criteria is to have people with an angle closure glaucoma, where the angle is narrow. Therefore, it can occlude whenever you have some sort of a pressure in the eye, and these are called angle closure glaucoma. Good thing there is, sometimes these people come with acute pain and acute red eye. If that is picked up in early stage, you can prevent the damage happening subsequently. This is a glaucoma, if picked up early, we can actually cure the glaucoma in these cases. Well, open angle glaucoma is very difficult, because there is not much of symptoms. The only symptoms can be there is, after 45 years you require near glasses, repeated change of glasses, or your vision contrast is going down. The things you could see clearly earlier, the things are not that clear, or you require more light, or you have some sort of a block from the sides. That means your fields are getting narrow. So this is how you can pick up the glaucoma. The other category is glaucoma happening in kids or children, which is called congenital glaucoma or a developmental glaucoma or a juvenile glaucoma. This is a separate category of a disorder. That number is small, but India with such a large population, this can be a very significant number also. I talked about secondary glaucoma. That is because of some other, you can see things which is happening in your body. We talked about steroids. You take tablets or put a drop in the eye, it can cause glaucoma. You undergo various surgeries in the eye, cataract surgery, retina surgeries, or you can do a corneal surgeries. With these, you can have a glaucoma happening in these cases with the uncontrolled intraocular pressure. That is called secondary glaucoma. It can be inflammatory, it can be with the tumors. Anything which causes rise in the pressure can cause glaucoma. This is called secondary glaucoma. So if you normally would understand, high intraocular pressure is a major factor which you have to see. Along with that, you need to see the inside the eye to the optic nerve head, because that gives a picture of a suspicion of glaucoma. If you have a suspicion, then you have a better diagnostic test. In this, we do a OCT to see the nerve fiber layer, its thickness, its amount, and this damage to the ganglion cells, which is a very minute cells which are then optic nerve. These are called pre-perimetric changes. Before the field defect comes, you can actually see these things happening with the OCT, and you can prevent the damage of a visual acuity, a visual field in these cases. So there is the importance of early detection, and most importantly awareness among the people who are having a family history of glaucoma, who have undergone some sort of surgeries of eye, or taking some steroids, some other medications, or they have a hypertension, or they have other disorders. So anything which can cause high pressure, you must get checked up done.
All right, so very comprehensively you've explained to us what is glaucoma. At this point, we're also joined in by Professor Kirti Singh, Director, Professor, Guru Nanak Eye Centre, Maulana Azad Medical College, New Delhi. She's joining us virtually. Thank you so much, ma'am, for joining us this afternoon on Wellness Watch. Dr. Titiyal explained to us in a wholesome way what is glaucoma, who all are at risk. And he also talked of how early detection and awareness are the key words to prevent glaucoma. But then I would want you to answer as to, can the IOP of a person, can that be reduced naturally, or for that matter maintained naturally?
IOP naturally can be aborted only in cases of angle closure attack, where the attack breaks off and then the pressure goes down. Other than that, the glaucoma IOP has to be controlled either medically, or by surgery, or by laser. And the worst thing about glaucoma is, as has been already highlighted, it is very silent. So the patient doesn't perceive whether the pressure has been lowered or not, but the vision definitely gets stabilized once the pressure is lowered.
Does glaucoma affect the entire vision of a person, ma'am?
Absolutely. It affects initially the peripheral vision. That is why there is a peripheral decrease in the vision, and then gradually it comes to the center. But in addition to the field of vision, it affects the contrast vision and the color vision. So those functional aspects of glaucoma are picked up early. Contrast means that when the patient goes from a dark room to a lighted room, the initial adaptation would be slow, or the reverse, when they go into a dark corridor, they'll have difficulty navigating, especially staircase, and in crossing the road, they'll have problems even in little ambient light. So that type of vision problems also happen, in addition to, of course, the peripheral constriction of vision, and in the end, the loss of vision.
All right, I'll take that forward to Dr. Titiyal. Doctor, you told us that it is very difficult to detect in the early stages. But then, if a person has glaucoma, how does his condition differ from other eye problems which cause pain and irritation in the eye?
Let's talk about in two different terms. Once we see that patient has an open angle glaucoma. As we discussed, these people definitely will have a lower contrast, which like Dr. Kirti talked about. Second is, sometimes they can have the repeated change of their near glasses, and mild headache which happens in these cases when the pressure goes up, especially when they are under a stressful condition, the pressure can go up, and they have the pain around their eyes, pain around their forehead, which may be because of high intraocular pressure. The most important thing for other group of cases where angle causal glaucoma suspects are there, early cases, some people we see that these are more common in ladies, and if you are in the dark for more time, suddenly they can have the pressure going up because the pupil dilates, and there is a peripheral crowding of iris or of the pupillary this iris tissue, which can block the angle area. So these are called subacute attacks, and this is how we can pick up these patients early. So these patients would have a acute headache, red eye, and these can be treated in a nice time early of their presentation. We can cure these patients by laser opening of iris tissue in those cases. But primarily most patients do not have symptoms, but symptoms which can be very silent should be picked up, especially with the high risk cases. If that is done, we can prevent the further damage happening in these cases that Dr. Kirti nicely described.
And what happens if it is left untreated? Will it always lead to vision loss?
Definitely, because this is one disorder if you are not treating properly. If you are taking medication also, but if you are not regular, you are bound to have a damage to your optic nerve, you definitely lose your vision. Even those patients who are on treatment, they might also lose vision because we do not know exactly what are various things which are actually impacting the optic nerve function. But if you are having an intraocular pressure which is well controlled to a level which is pertaining to a particular type of damage to the optic nerve, you might sustain this vision for a very, very long time, because ultimately this is going to take your vision.
All right, Dr. Kirti, sir did mention about juvenile glaucoma. Added to that, do tell us that is there any particular age group that is more prone to glaucoma? And also the second part of the question is, how is juvenile glaucoma treated?
So juvenile glaucoma is a whole gamut of glaucomas right from childhood to early adulthood, or let's say in the second decade or maximum third decade. Now congenital glaucoma, which the child is born with, is the worst type of glaucoma, because at that time the eye is very pliable, so the eye increases in size. That's called as buphthalmos. The child has watering of the eyes and they have corneal haze, and the child literally cannot see and will try to bury his face or her face in the pillow, and there will be problems in vision. That type of glaucoma always requires surgery and requires a lifelong monitoring, and these children very often don't have poor vision, and they would need that handicap certificate so that they can go into schooling, which is called as integrated schooling. Coming to the juvenile aspect of glaucoma, that happens at an early age, early adulthood, and because the trabecular damage is there, there's a congenital tendency for the damage to be there. These glaucomas behave worse than the adult glaucomas, which are by degeneration. And the juvenile glaucomas have a poorer prognosis and they often require surgery. And the worst thing is that they are impacting young adults who are in the functional stage of life, like they have to work, they have to run, they have to do a sports activity, or they have to do their transport, they have to drive a car or a motorbike. So it's impacting the working young adults. And how to pick it up, because again glaucoma doesn't come with a sign,
Yes.
like cataract comes that the lens becomes opaque and it's visible. Glaucoma is silent, you don't come to know. So how to pick up juvenile glaucoma is, again, if there's a family history of glaucoma, if the person is on steroids, if the person has repeated problems in contrast or change of glasses, they should get themselves checked up, especially for glaucoma, and they say to the doctor that I have to be checked for glaucoma. And here I'd like to highlight one very important aspect. Whenever you get a checkup for glaucoma, just remember 4 things. One is the intraocular pressure. Second is seeing the fundus or the retina for the optic nerve look, which is called as the optic disc assessment. Third is the visual field, where you are the patient is asked to look in the periphery, in the center, and to see where all the patient can see. Fourth is very important in India is to check for the angle, which means angle means there are two types of glaucomas: narrow angle glaucoma and open angle
Open eye,
glaucoma.
yes.
In the narrow angle glaucoma, treatment is very different in the initial phases. So if you can do a laser in the initial phases, if you pick up early, the glaucoma may be arrested for many, many years. And if it's not treated in time, this type of glaucoma is worse than the open angle.
All
And
right.
even in the United States, you can have both angle closure and open angle glaucoma. Therefore, all the four tests have to be done to pick up this glaucoma.
All right. I'll bring in Dr. Titiyal here. Sir, when we talk of glaucoma, then is it permanently curable? And what are the chances of its recurrence?
Now, let me continue with the discussion we had just now. Congenital glaucoma or a juvenile glaucoma cases do have the more tendency of genetic inheritance. So, genetic tests may be required in these cases for future, planning of how we can cure these patients. And sometimes a patient with very high pressure, especially juvenile glaucoma and a narrow angle glaucoma, they can come to us with the colored halos. They see a colored rings around the light, and that indicates high pressure and edema in the cornea. So, you can pick up these patients early. If you have a colored halos, when you are watching the movie for 3 hours, come out, you see colored halos, you can have a glaucoma. That's the one very important thing people have to understand. As far as cure is concerned, open angle glaucoma, we can prevent the blindness for a long time, because it is a very progressive disease. Despite the control of intraocular pressure, you may still lose the vision, because we don't know exactly how other things act on the optic nerve function. But yes, if pressure is well under control, then your progression of disease can be slowed, or sometimes it can be prevented for very long time. We don't have a absolute cure for open angle glaucoma. Well, angle causal glaucoma or a narrow angle glaucoma, if you pick up early in a stage, you do a peripheral iridectomy or open the opening in the iris tissue, this glaucoma can be prevented, or you can be out of damage, or you can have a permanent cure also in these group of cases.
All right. Professor Kirti, what are the medical advancements that have been made in this field when we talk of glaucoma treatment in India?
So, medical advancements are that there are many eye drops available, and there are combination drops available, because it's not easy for an elderly person or anyone to keep putting eye drops in the eye. So there are combination drops available, that is the advancement, and there are many drops available which will control the pressure pretty well. There are new lasers available which can also control the pressure. There are new surgical advances where a mini surgery or a micro-invasive surgery can also control the glaucoma.
Right.
Good, very nice.
In addition to that, there is something called as a preservative-free drops. Like any eye drops in the eye will damage the conjunctiva, which is the mucous membrane covering the eye. So the preservative-free eye drops are better for the eye. They will cause less damage to the conjunctiva.
Right.
One more thing I would like to also highlight in this very important program which you are doing, there is one glaucoma which is very much preventable by not using one eye drop. That is the steroids. What happens is, whenever there is itching, and in India, most of us are born doctors. We know what the sickness is and we know what the treatment is. And once we get one eye drop by the chemist or by the doctor, we keep using that eye drop.
Right.
So these children, especially the vernal conjunctivitis children, which is again common in Asia and India, these children have itching and watering, especially in the summer months and the spring season. And the parents put the eye drops, and whenever they have itching again, they'll keep using the eye drops. And this type of glaucoma, or the steroid-used glaucoma, is totally preventable by not using the steroids unnecessary. Sometimes you have to use the steroid eye drops, but using them unnecessary without prescription, without advice of doctor, causes SIG, and this is a very bad glaucoma which is drug induced.
So in a nutshell, it is awareness that what matters. Up next, we'll have a quick rapid fire round.
I will not be able to tell that his vision is going.
Right. We'll have a quick rapid fire round. I'll ask you some myths and I request you to answer in very crisp forms. Dr. Titiyal, glaucoma only affects one eye. Is it so?
Not necessarily. It is a bilateral disease. It will affect both eyes. Yes, you can have little difference in the two eyes in terms of severity.
Professor Kirti, people with perfect vision will not get glaucoma ever. Is it so?
Not people with any type of vision can get glaucoma. As we said, the older one gets, it's a degenerative disease, so many of them do get glaucoma.
Glaucoma only occurs if you have elevated eye pressure. Dr. Titiyal.
No, majority of time, yes, but you can have be low pressure or normal pressure glaucoma also.
Glaucoma progression can be halted by lifestyle changes such as yoga and other physical exercises. Dr. Kirti.
Not really, but walking and mobility, moving makes the blood vessel permeability better, makes the vascular flow better. So the treatment of the optic nerve perfusion becomes better. But glaucoma per se has to have an IOP reduction. However, studies have shown that meditation and calming of the mind does cause reduction in the IOP. And please remember this, the inner eye is a part of the body. If the body is healthy, generally the eye milieu also becomes healthier. So definitely walking, yoga, meditation, whatever is important for the body and therefore for the eye, it may not be for glaucoma specifically, but for many conditions like diabetes, which also involves the eye, and for all the degenerations, it's definitely important.
Laser treatment for glaucoma is dangerous, Dr. Titiyal.
Not at all, because laser is one of the treatment for some types of glaucoma, because there are various types of surgeries through laser can be done, and it can be prophylactic, preventive and treatment also.
A person with glaucoma will eventually become completely blind, Professor Kirti.
If they don't take treatment, unfortunately, yes.
All right, with that, we end this discussion here. Thank you so much, both of you, for joining us and helping us understand glaucoma better. So after this discussion, we did understand that glaucoma is the silent thief of sight, advancing without pain, without warning, and often without mercy. By the time it is discovered, the damage is irreversible. Yet, within this silence lies hope. Early detection can halt its progress and preserve vision for a lifetime. Remember, eyes don't complain until they don't see. You see your doctor, protect your vision, and keep the world in focus. With that, we end this edition. Thanks for watching. Bye-bye.